Good afternoon, everyone. Thank you all for joining our second Let's Talk About Sex Facebook Live event. For those that joined us during our last event and are back, welcome back. And for those that are new, go ahead and enjoy the content that we're going to provide to you all today. We will be talking to you all about several things that are very important in the community, such as statistics within HIV and AIDS in Florida. We're going to talk about myths and misconceptions when it pertains to PrEP medication and HIV. We'll be talking to you all about who True Health is, what we do, what we offer, and how you can join PrEP with us at True Health. And we will also be discussing a very important topic for us all, which is discordant partners. So I want to just kind of remind all of you of a disclaimer here. And this Facebook Live event does contain content that can, of a frank discussion. So we will discuss sexual health topics. And so we want to make sure that the viewers are advised that only individuals that are comfortable with this type of content tune in. Of course, all of the information given to you today by the team is given in good faith and should be used for educational purposes and not to treat or manage any diseases or conditions. Always seek attention from your healthcare provider. Also, I want to remind you that at the end of this event, we do have a short survey. And if you complete the survey, you will be able to enter to win a $50 gift card. So please don't forget to do that. Now with no later ado, let's go ahead and introduce our PrEP team. First, we'll start with me. I'm Luisa Mena, and I am the medical director here at True Health. And I will now pass it on over to Mr. Japhet Rios.
Good afternoon, everyone. Pleasure to be on the call with you all. My name is Japhet Rios. I serve as Regional Director of Operations for True Health. And with that, I will kick it over to Ms. Bernadette Pearson.
Hello, everyone. My name is Bernadette. I am an HIV case manager for True Health. And next up, we have Gil.
Good afternoon, everyone. My name is Gil Reed Lugo. I am the Community Outreach Specialist with True Health. Now I'm going to pass it off to Giovanni.
Good afternoon, everyone. My name is Giovanni Rollo, and I am Center Manager for Lake Underhill, and I will bring it back to Dr. Mena.
Thank you, Giovanni. So as I said at the beginning, we're going to give you all some information on what True Health is, who we are, what we offer, and how you all can reach out and become part of our True Health family. So I will go ahead and introduce our Region 1 Director of Operations, Mr. Japhet Ignacio Rios.
Thank you, Dr. Mena, for that warm introduction. Like I mentioned earlier, my name is Japhet Rios, Regional Director of Operations. Before we dive into the topics, I would like to just give an overview about our organization. True Health is a federally qualified health center here in Central Florida. Since 1977, our mission has been to provide high quality, comprehensive healthcare at a reasonable cost to everyone. We do this through our vision of healthy communities through life-changing care. As an organization, we have 8 locations in total, 4 in Orange County and 4 in Seminole County. And the services include adult care, pediatric care, podiatry, pediatrics, lab, pharmacy, obstetrics and gynecology, optometry, behavioral health, psychiatry, dental, x-ray, our outreach and enrollment team that specializes in insurance enrollment and social determinants of health. And last but not least, our PrEP team that is here on the line with you all. So that's a little bit of information about True Health. I will kick it over to our medical director, Dr. Mena.
Thank you, Japhet, for the wonderful information. So the topic for today is zero discordant couples. Before I get into that, I just want to talk to you all about the importance of behavioral health when it pertains to PrEP and HIV. So PrEP, just as a reminder, is pre-exposure prophylaxis. This is a medication that's been approved by the FDA and CDC to offer to patients or peoples that are at high risk for getting infected with the HIV virus. So this medication, if taken as prescribed, will reduce your chances by 99% that you will not get infected with HIV. So, why I say that is because when patients join or become part of our PrEP team and start the PrEP medication, one of the things that True Health focuses on, which is one of the most important things, is risk behavioral modification. The point of our behavioral team as it pertains to PrEP is to educate our patients, to counsel them monthly, and to make sure that they understand that risk reduction is of the essence here. So a PrEP will prevent you from getting infected with HIV, but it will not prevent you from getting infected with other sexually transmitted diseases, which we covered some of those during our last event. So we want to follow the true path and mission of people that go on PrEP, which is to ultimately reduce their risk, modify their lifestyle behaviors, and get them off PrEP, right? That would be the ideal. The reality is some patients are able to do that, and then we have a special population of our patients that are not. And those are the patients that are involved in a discordant relationship. So let's get right into this here, guys. This is very important because I'm pretty sure we all know someone that is HIV positive and someone that's living with someone that is HIV positive. So just to make it clear, when we say concordant couple, what that means is that both individuals have the HIV virus. They're both HIV positive. When we say discordant couple, then what that means is that one individual has the virus, but the other one is HIV negative. Next slide, please. And so we've researched a lot when it comes to zero discordant couples, because the reality is that these type of couples do bring about a special category, if I may, within the HIV positive population. So this term basically refers to an intimate partnership, right? And like I said, one of the individuals is HIV positive and the other one is negative. And in research studies, the couple relationship is typically defined by, number one, their marital status, two, cohabiting or co-parenting status, the length of the relationship. So minimum 3 to 6 months or 3 months and up will be considered a zero discordant couple. And then, of course, if there's intention to stay together. So even if you don't have 3 months together, but there's intent to do so, that is considered a discordant couple. Also, reporting a certain minimum number of sexual acts with this individual also is within a specific time frame, also can define the couple as a zero discordant couple. So in general, and I hate to say it, but couples do not really stay within that classification of discordancy forever. And the reason is, after a while, the HIV negative individual is now considered exposed but uninfected. Next slide. So how does this group of individuals play a role in maintaining the global HIV epidemic? Well, many research studies within the United States as well as outside the United States. There is a big research study now going on in the sub-Saharan Africa. And what these studies are telling us that in any area where there's concentrated epidemic of HIV, there's anywhere between 0 to 6% of the couples who will be zero discordant, right? And so, but in the general epidemics population, then that will range from anywhere from 9 to 17. Now, so this obviously of zero discordant is a topic that we all want to educate ourselves in and try to bring that education to as many people as possible, because doing so will reduce the risk of the HIV negative individual to become positive, and therefore will be an overall burden even more to the HIV epidemic. Approximately in sub-Saharan Africa, there's approximately half of HIV positive persons have a negative partner, and that's pretty high. And so in sub-Saharan Africa, there is a really, there's an area where there is a high prevalence of HIV infections, new infections as well. In the settings of low prevalence, then the proportion might be as high as 75%. In 2013, there was a study about in 20 sub-Saharan African countries, and it was estimated that about 29% of new infections occurred within a stable zero discordant couple. In other words, zero discordant couples, one negative, one positive, and then one finally becomes positive. So now they're both positive. And that was at a pretty high rate at 29%. There's an estimate also in Zambia where 60.3 to 94.2% of all new heterosexual HIV infections occur to zero discordant married or co-inhabitant couples. So also among MSM, and MSM is men who have sex with men, there is an estimated 33 to 67% of new infections that occur within the primary partnership. Again, that's a pretty high number. Next. So we have guidelines, and these guidelines are internationally known, and they should be followed worldwide. And this is in efforts to decrease that increase of couples both getting infected. So international guidelines, number one, it recommends strongly for couples HIV testing and counseling. Okay, so all of these couples that are zero discordant are encouraged to test and also do the counseling portion as well. That will give them the support to be able to disclose their status to each other, which might not be an easy thing for some to do. Also, for the positive individual, it is recommended to start them on antiretroviral medications, regardless of their CD4 count or disease stage. It used to be before where if you're HIV positive, you wouldn't be started on medications until your CD4 count was up to a certain number. Now that is not the case. As soon as a person is known to be HIV positive, they can go ahead and start with the antiretroviral medications. In doing so, when it pertains to zero discordant couples, the medications will keep the viral load down and undetectable. And if your viral load is low or undetectable, then the risk of transmitting it to someone else will be very, very low. So that is the idea behind that. Also, for the partner that is negative, we want to highly consider starting them on pre-exposure prophylaxis. And these are, again, for the ones that are HIV negative within the relationship. And then, of course, those relationships or partners that are wanting to get pregnant or are pregnant, obviously offering them the HIV testing and counseling, as well with support for mutual disclosure, really keeps that risk down for vertical transmission or transmission to the other partner. Next. So preventing HIV transmission within the zero discordant couples, this is the main thing here. And if I want you all to walk away with something today, it would be with some of these preventative measures. Number one, we can do the behavioral health approach. And within that approach is when it entails the couples HIV testing and counseling. When zero discordant couples follow this protocol or guidelines, number one, it increases the rate of HIV testing. It increases the use of condoms. It decreases the risk for the other partner to become positive. And it also decreases transmission overall with any other sexual partners that they may have. So, and also safer conception. So for those that want to get pregnant, they would do so safely without the risk of vertical transmission to the fetus. Also, there is increased psychosocial support. So the more education the community has, the more resources we offer, the more support there will be, and the better the outcome will be for zero discordant couples. Also, there's a decrease in numbers of unplanned pregnancy, and there's also an increase in uptake of the family planning services. So, the more you educate individuals that want to get pregnant and are in a zero discordant couples, give them the resources, and those numbers go up automatically to where they're utilizing those resources more to reduce that risk of vertical transmission. Next. Biomedical approaches. These are more focused on medications and medical interventions. Number one, medical male circumcision can definitely reduce that transmission rate. Testing and treatment for sexually transmitted infections, antiretroviral treatment as prevention, right, which is the TSP, which is a little bit different from PrEP. Antiretroviral treatment as prevention for MSM couples, pre-exposure prophylaxis, which comes in the form of oral PrEP, which True Health offers. Vaginal gel, True Health does not offer the vaginal gel. However, we do refer, and we are able to refer and connect patients that want to go that route with the resources that can offer them that. And then, of course, PrEP for conception. So these are the women that want to get pregnant and need to go on PrEP. There's also the use of monoclonal antibodies that is still under clinical trials. And then there's the non-occupational post-exposure prophylaxis. So that is the prophylaxis for patients or individuals that have sexual contact with someone that is known HIV positive. And so now we're going to treat them with the medication for 3 months to prevent them from becoming positive. Next. Here I have some references for y'all that you can refer to. You can go to the National Center for Biotechnology Information, National Library of Medicine. We have journal list, CDC. We have the FDA have a lot of information on these topics. You can also log into the Department of Health, Florida, specifically for counties or just in general for the Department of Health. And they have a lot of information on PrEP, on HIV, on zero discordant couples, how to go on PrEP, and you'll have a list of all of your resources there in case that you need to tell a friend, a neighbor, for yourself or a family member. And so that being said, I will now kick it on over to Mr. Giovanni Rolone. He's going to give you all a nice overview on statistics on HIV and AIDS within the communities in Florida. Giovanni?
Hi, next slide, please. Okay, so just some quick facts on HIV statistics in Central Florida, and this is based on 2020 information. About 117,000 people were living with HIV in 2020 in Florida. Out of those 117,000, 13,000 were living in Central Florida. Around 10,000 of those people received HIV care. 9,112 reached viral suppression, and about 3,900 were not virally suppressed, meaning that there was a higher likelihood of being able to spread the HIV. Next slide, please. When we look at the percentages, we can see that about 506 people were diagnosed with HIV in 2020 in Central Florida. Out of those, 82% were males, 18% were females. When we look at the percentage by race or ethnicity, we can see that Black and Hispanic occupy about 70% of the scale, while females, white individuals, occupy about 19%. When we look at it by age, we can see that between 25 to 59 is about 70% as well of the scale. Next slide, please. When we look at it for the past 5 years, we can see that there has been a decrease in 2020. When we look at 2016, 17, 18, 19, we can see that the numbers are over 600. The reason that we believe that in 2020 that numbers went down to 506 is because COVID happened. However, there is no recent data for 2021, 2022 yet, but there is some thoughts there that the numbers might have gone up over the 506. Next slide, please. When we look at it again by sex, when we look at it by ethnicity, and when we look at it by age, we can see that males, Black and Hispanic are at the higher rate here, are kind of trending. And then when we look at it by numbers, we can see by age, we can see that 25 to 59 are also on the higher end, and individuals 60 and over. The rate of Black males living with HIV diagnosis is 4 times that of a white male. The rate of a Black female living with HIV diagnosis is 16.9 rate that of white females. The rate of Hispanic Latino males living with HIV is 2.2 that times that of a white male. And then the rate of a Hispanic Latina female living with HIV is 5.3 that time of a white female. When we look at the risk factors, we can see that male-to-male sexual contact is 72.2%, followed by heterosexual contact at 11.2%, and then injection drug use at 6%. When we look at it on the female risk factors, we can see that heterosexual contact is at 74.2%, injection drug use at 12.4%. Of 1.2 million people in the United States and Puerto Rico who could benefit from PrEP, only 25% of those were prescribed PrEP in 2020. When we look at the numbers, we can see that top 2 are kind of New York with 47% of individuals that are utilizing PrEP that are eligible for it, and then DC with 46%, when Florida is at 28% only. That is it for me, so I'm going to pass it over to Gil.
All right, good afternoon. Again, my name is Gil. I'm the Community Outreach Specialist. So today I'm going to be talking about myths and misconceptions about PrEP. Next slide, please. 10 common myths about PrEP are: PrEP is only for gay men. Condoms are not needed if the person is currently on PrEP. It is hard to get a prescription for PrEP. PrEP only needs to be taken after having unprotected sex. PrEP is expensive. PrEP is only for people who have multiple sex partners. PrEP is not needed if you're a top. PrEP should be taken every day. PrEP has bad side effects, and a patient will need to stay on PrEP for the rest of their lives. I will say, for number 1, PrEP is only for gay men. A fact is, PrEP is for anyone who doesn't have HIV, but it is at risk for contracting HIV through sex or IV drug use. The CDC recommends PrEP if they've had anal or vaginal sex in the past 6 months, and if them and their partners don't use condoms, if their partner has HIV, if you were diagnosed with an STD in the last 6 months, or if you're a woman with an HIV positive partner and you're trying to get pregnant. In regards to condoms that are not needed for people, if the person is currently taking PrEP, PrEP is only effective against contracting HIV. It is not effective against any other STDs like syphilis and gonorrhea. So we still recommend safe sex practices, meaning using condoms. It is hard to get a prescription for PrEP. The fact is, any licensed healthcare provider can prescribe PrEP. If they do not have a primary care doctor, they can visit a True Health clinic, or they can search through a doctor through our HIV services locator or hiv.gov. PrEP needs to be taken after having unprotected sex. The individual must take PrEP consistently for it to protect them against HIV. Pre-exposure prophylaxis, or PEP, is the pill that's taken after having unprotected sex. PEP is to be taken within 72 hours of possible exposure. It is very effective at preventing HIV. PEP is only for emergencies and is not a substitute for PrEP. PrEP is expensive. Fact is, PrEP medication can be expensive and it can cost us several thousands of dollars a month. Adding lab tests and doctor's visits, it could add up as much to $15,000 a year. However, the patient may not have to pay a specific amount. This is something that's federally funded through our government, so True Health does not charge or will not charge for these services to be a part of the HIV PrEP program. PrEP is only needed for people who have multiple sexual partners. Even if you have sex with one person, it is good to take PrEP if your partner has HIV with a detectable viral load, or if you're not sure of your partner's HIV status, if your partner's an IV drug user, or if your partner has sex with multiple people. PrEP isn't needed if you're a top. The thing is, the risk of getting PrEP of HIV is higher for the person that is a bottom, meaning that if they receive anal sex. If the patient is a top and gives anal sex, the risks are less. It is possible to get HIV as a top. So it is still important to take PrEP to protect yourself along with using condoms. PrEP should be taken every day. It depends on which type of PrEP the patient chooses. Daily PrEP and with Descovy and Truvada is a pill that must be taken every day. PrEP has bad side effects. PrEP is safe. Most people don't have any side effects. Most of the side effects are mild and can include headache, nausea, diarrhea, tiredness, rash, and belly pain. Those typically go away after you take the medication for a period. A patient will need to stay on PrEP for the rest of their lives. The patient can go on and off PrEP the patient go off PrEP as long as they're no longer showing risk or at risk for contracting HIV. The patient should ask their doctor on how they can safely stop taking these medications. And aside from that, I think I'm done with the myths and misconceptions. So I will pass this off now to our HIV case manager, Bernadette.
Hello, everyone. I'm Bernadette. I'm an HIV case manager for True Health. Next slide, please. So True Health, we're excited that we've been funded by HRSA in order to provide the PrEP program to everyone at no cost to them if they qualify. Next slide, please. So when the prescription is taken, it's highly effective and it can prevent a person from catching HIV from sex or injection of drug use by 99%. Next slide, please. So is PrEP right for you? PrEP would be right for you if you've had unprotected sex in the past 6 months, if you've had a sexual partner who has HIV, if you don't regularly use condoms, if you have been diagnosed with another STD in the past 6 months, if you share needle or syringes to inject drugs in your system in the past 6 months, and if you are a female and have a partner with HIV and are considering getting pregnant. And also, I wanted to add that if you are pregnant, it is safe to take the medication Truvada, as well as when you're breastfeeding. So that's an added bonus with the medications. So how would you enroll in the PrEP program? Well, once you are registered as a True Health patient, the provider can order the necessary PrEP blood work, which can usually be done during the initial office visit on their way out, because True Health does have labs right on our property. So I would be notified to set up the rest of your requirements of appointments that's needed to stay in the PrEP program, as well as if you're uninsured, I can help assist in getting the medication through Gilead so it can be no cost to you. So requirements to stay in the program. What do I need to do if I wish to join the PrEP team? You need to get blood work done every 3 months. You also will be required to have PrEP counseling every 3 months. The goal here is to train you and educate you in practicing safe sex practices. And then, of course, a visit to a True Health provider every 6 months. And all of this is at no cost to you because we're funded by the government through HRSA. Next slide. So now I'll take it over to Dr. Mena.
Thank you, Bernadette. Thank you all for great information. So right now, what we want to do is we want to open it up to questions, comments, concerns. This is your time to get your questions answered, or if you want to give us some information that maybe you didn't hear here, this is the time. So we're here for you guys. Okay, so it looks like we have a question here. How should a person know when they can stop taking PrEP? So that's a very interesting question. The ultimate goal is to reduce patients' risky behavior so they can eventually get off PrEP. So connecting with your mental health counselor here at True Health, part of our PrEP program entails a behavioral health visit once a month, where the provider will go over their risk factors, where they're at as far as PrEP, and we'll go over their HIV results every 3 months. We do test our patients every 3 months. So having that discussion with your behavioral health provider definitely will give you that guidance as to areas that you need to work on. Is it a prudent time for you to stop taking PrEP, and so on and so forth. Very good question. Okay, another question is, how old do you have to be to start PrEP? So overall, PrEP at 13 years of age is acceptable as long as the person is at least 20 kilos or more. Here at True Health, our pediatric providers are comfortable starting pediatric population at age 16. However, we do consider patients that are younger than that if they are deemed to be at very high risk. And if this is a discussion that, the parents is willing and wanting to have with the pediatric provider. Let's see. So it says, my next, I want to make sure I don't miss anyone. Can PrEP be taken only on the days when having sex? No, that is another mode or another type of guidelines for taking PrEP, which we are not offering here at True Health. It is actually still being looked at by the CDC. It is being offered in some European countries like I think Australia, and don't remember which other ones, but that's called PrEP on demand. And basically, this is going to be people that know that they're going to have an exposure. They would take the medication a certain time before the sexual activity, and then of course after as well. That also reduces the risk. However, that is something that is not yet part of PrEP here at True Health. So is PrEP something that is covered through insurance? If not, is it free? The HIV epidemic is really big, and in the past several years, specifically here in Florida, we've had a lot of initiatives to try and combat this epidemic. And in doing so, a lot of the health insurances are on board with paying for the medication. So PrEP here at True Health goes as follows. If you have health insurance, we will be able to bring you in, provide you with the counseling sessions quarterly. We will be able to get you to see the provider, and we will start your blood work as well as your prescription, and we would start you off based on your insurance. We also have our HIV case manager, Bernadette, who will connect those persons that have insurance to the copay assistance program through Gilead. So the idea is that they shouldn't have not 1 cent out of pocket to pay for their pre-exposure prophylaxis medication. And of course, those patients that have no insurance, we enroll them in the prescription program through Gilead, which is also assisted by Bernadette. So we make sure that everyone that wants to be on PrEP and that is a good candidate for PrEP can be on PrEP without the burden of any financial issues. And so someone wants to know if they have high blood pressure, is it still okay to take PrEP? Yes, the answer is yes. So PrEP is one medication, it's just one pill, one a day. And we have either Truvada or Descovy, and which medication the person gets pretty much will have to be a discussion with their healthcare provider. Regardless of which one is chosen, these medications are very safe. They have not demonstrated to be an issue with other comorbid conditions like high blood pressure, diabetes, or high cholesterol, or any of those other diseases. The only disease that we screen people for is kidney issues. So anyone that is like on dialysis, have really bad kidneys, kidney transplant, are not patients that would be suitable for PrEP. Is the required blood work just checking for HIV? No. When we do blood work every 3 months for when we start someone on PrEP, number one, we want to check HIV every 3 months to make sure that they remain HIV negative, but we also want to check for the other STDs like syphilis, hepatitis B and C. We want to check for chlamydia, gonorrhea, trichomonas, and herpes type 1 and type 2. And the reason being is that at the beginning, remember I said PrEP will prevent you from getting HIV, but it will not prevent you from getting other sexually transmitted diseases or unwanted pregnancies. That's why it's so important to come to True Health for PrEP, so that you are assured that we're going to provide you not just with a pill and send you on your way, but you would also have that behavioral health risk counseling for risk reduction or risk modification. For the PrEP medication, Truvada and Descovy, are they both for everyone or gender specific? Actually, the Truvada is the medication that we prefer to give to females, and then the Descovy would go for the males. However, we definitely can offer a patient that is a female that had an allergic reaction to Truvada, they can also go on Descovy. So the medication and which gender is pretty much based on clinical trials research in the past. And the Descovy was not researched in females as much as it was researched in males. So that is the reason why Truvada mostly for females and Descovy for males. But it doesn't mean that you cannot interchange them if the person had an allergic reaction or just had some side effects to one or the other. What is the most accurate form of testing, blood work or over-the-counter testing? So blood work done in a healthcare facility is always going to be more accurate. However, the ones that you take home that are done in the saliva, and these are the rapid HIV tests, they do have a pretty good rate of specificity, meaning that if the test say is positive, well, then there's that 75% that it really is positive. So it's got a 25% rate of false negatives. Anytime a person tests at home, they should always confirm those results. So having a positive test at home doesn't necessarily mean that yes, you are HIV positive. You need to follow up with a blood test. So you need to contact your healthcare provider and then come on in and get a blood test. The same thing goes if your test is negative. If your test is negative and you know that you are a high risk individual, or you had unprotected sex with someone that is known to be HIV positive, a negative test does not preclude you from having the virus. You still need to confirm with a blood test. And also there's the important question of, if I'm exposed today, when will I know if I have HIV? And the magic number is 3 months. Always remember, 3 months is that window period. So if you get exposed to HIV today, we of course want to test you for HIV as soon as we know that you had the exposure, and that result will be used as a baseline. We want to make sure that you weren't already positive. And then 3 months later, we will retest, because it takes that 3-month window period for the virus to develop enough in your blood for it to be detectable in our traditional Western blot or the ELISA test that we do in the blood. What if I miss a dose or two of PrEP medication? Will it still be effective? PrEP will be 98, 99% effective if taken as indicated daily. If you miss a dose, say today, you can continue your regular regimen after you take that extra dose when you remember it. However, you cannot do that if you miss more than one dose. If you miss more than one dose, then you should just pick up where you left off. The days that you forgot, you don't want to make up those days, but you want to keep in mind that you have to wear protection, because in order for PrEP or Truvada and Descovy to start protecting you in your blood, where you have enough of the drug concentration to actually protect you from HIV, that normally takes anywhere from 7 to 14 days, and that depends on the individual. So it's a very good question, and it's very important to keep that in mind, and always reach out to your healthcare provider or your behavioral health provider if you have concerns that you missed a dose or two, and they would give you proper indications. Do you offer the PrEP medication as an injection as well? We don't offer it right now, but we are looking to getting this medication, perhaps via a grant. There's a lot of grants out there to help lower this, or eradicate, if possible, right, someday, HIV, or at least to lower the infection rate. So the injectable is a very good medication, especially for those that don't want to take pills, or they're just not good at taking pills. It is an injectable that you do once a month, every 2 weeks at first for the loading dose. And then after the first month, then you could take it monthly. It is costly. So we are working diligently here at True Health to try and see if we can get a grant to get those injectables to offer to our patients, because some of the patients have actually not wanted to go on it because they're not good with taking pills daily and they prefer the injectable. I don't see any other questions. Let's see. Okay, here's one. What if I start taking PrEP meds, then find out I am positive for HIV? Is that harmful? If you're HIV positive and you're taking PrEP, it's not harmful. However, you're not getting the proper treatment for HIV. So if you're taking PrEP and you become infected with HIV, it is important to go to your healthcare provider. They would link you to infectious disease specialists. They would do more blood work, and they would start you on your antiretroviral medication. So remember, the PrEP, Descovy or Truvada is not enough to keep your viral load down on their own if you were HIV positive. So it's not going to harm you, but it's not going to be beneficial to keeping your CD4 count where they should be and the viral load down. So always, your healthcare provider will refer you if there's a positive test, and they will stop giving you the PrEP medication to make sure you get the proper treatment for the HIV infection. All right, guys, I don't see any other questions. I just want to thank you all for joining us today. Please visit our website, which is mytruehealth.org. We have all of our information there as far as our services, what we provide. You'll be able to check out our leadership team. You'll be able to look at the providers. You'll be able to see our different sites and their locations, phone numbers, our services. And we also have a section just for PrEP. And there you can get all of the information that you want to for PrEP. You can also send a message and someone will get back to you if you're interested in PrEP. So again, I thank you all for joining, and I hope to see you all come on through our doors, not just for PrEP, but just for regular services. And don't forget to complete that short survey at the end, and that way you can enter and hopefully win a $50 gift card. But also you would let us know how we're doing and what areas we need to improve. We want to make sure that we bring you the most up-to-date information. Thank you all.